but this is a suspense. So let us hear what each one of us has to tell you. So today I'll be speaking on a question that often comes up in every OPD and every public forum. Is LASIK still relevant? With newer procedures like SMILE and ICL gaining attention, it's important to understand where LASIK stands today, scientifically, practically, and in the patient perception. This is the legacy of LASIK. LASIK revolutionized the refractive surgery when it was introduced in the 1990s. More than 40 million procedures have been done worldwide with over 95% satisfaction. And it earned this trust because LASIK consistently delivered fast recovery, excellent accuracy, and predictable outcomes. It has truly laid the foundation for our spectacle-free world. So why LASIK became so popular? Patients loved LASIK because of how quickly it gives vision, functional vision, often within hours. And it was affordable, accessible, and produced stable results. So for nearly 2 decades, LASIK was the go-to procedure for most refractive errors. But today we have newer techniques like SMILE and ICL. But these are not replacements for LASIK. I would like to describe them as adjuncts. That is the procedures that fill the gaps where LASIK cannot be offered. For example, SMILE helps when we want a flapless, more biomechanically stable option. And the ICL works in thin corneas and very high myopes. Together, LASIK and SMILE and ICL allow us to personalize refractive correction for almost every corneal profile. So there will be no ideal LASIK candidates because of the thin corneas and the high powers and all, and they might be looking for flapless or more biostable options, and these gaps can be filled by SMILE or ICL. One major historical limitation of LASIK was the fear of ectasia. But modern screening has completely changed this. Today we have the pentacam, the tomography indices, the Bellin-Ambrosio display, epithelial mapping, corneal biomechanics with the Corvus ORA and all. The ectasia risk after LASIK had dropped dramatically. And today ectasia is rare but not zero, particularly in borderline cases, very young patients or subtle form frustic keratoconus. We should always keep this probability in mind. So remember, proper screening is versus technology matters. And also there is a dry eye risk because the LASIK does cause temporary nerve disruption because of the flap. So dryness is common for 3 to 6 months, but it is predictable and very manageable. So dryness with the preoperative MGD assessment with your omega-3 fatty acids or plugs or aggressive lubrication, most patients remain very comfortable. And in those with existing dry eye, those patients who come with you saying that I am having severe dry eye, then SMILE or PRK becomes the better choice for them. In very high myopia, removing more tissue can lead to mild regression over the years. It's uncommon, but it can happen beyond -8 or -9 diopters. Most cases can easily be corrected with enhancement or in borderline corneas, shifting them to ICL if there is the residual stromal bed is very thin. This is actually one of the biggest challenges today. Which one? The public perception of LASIK being outdated. You must have heard that a lot of patients come and asking you, Doctor, LASIK is old. I heard SMILE is newer and better. And a lot of this comes from social media marketing. But the reality is modern LASIK is safer and more advanced than ever. With wavefront guided, topography guided, and ray tracing platforms, LASIK today offers precision that was not possible 10 years before. So evidence also speaks. Multiple comparative studies, including the Reinstein's large 2023 work, shows that LASIK, SMILE, and ICL all have excellent outcomes. LASIK still remains the most predictable and most accurate for the majority of routine myopes. So, in nutshell, at a glance, the evidence and outcomes shows that visual outcomes are equal to SMILE. Patient satisfaction is almost 90 to 95%. Enhancement rate is low, maybe 2 to 4%, and the safety is excellent with the femtosecond platform. Thus, LASIK remains the gateway procedure in the pursuit of spectacle freedom across age groups. Future trend is becoming even more exciting. AI-based screening is improving our ability to detect subtle patterns that even experienced clinicians may miss. So these AI-based screening is also very important. And techniques like LASIK Extra, that is combining LASIK with accelerated cross-linking, are helping to improve the biomechanical stability in particularly high myopes, younger patients, and borderline corneas. And this reduces the risk of regression and enhances the long-term stability. We now have the ability to map the corneal irregularities with extreme precision. Topo-guided LASIK is excellent for asymmetric astigmatism or decentered aberrations. Wavefront-guided LASIK helps reduce the higher-order aberrations and improves night vision quality. So the take-home message: in our journey towards spectacle independence, LASIK remains a vital and time-tested choice. Thank you.
Now we know LASIK is still relevant provided the proper preoperative criteria is followed.